To just give a quick update on all the some of the advocacy efforts for the association this year. And some of you already are aware of many of these, so I'll just kind of hustle through some of them. We have a compact bill that is still in play. So it started out as a House originated bill. That number was 2190, I believe. It ran and got all the way through the House. It went over to the Senate, got stuck. So we started over with a strike everything amendment for another Senate bill. So that's why it is now SB 1448 as a strike all amendment. It has just recently passed out of the House again, and now awaits to be final read in the Senate. So a compact, for those of you who may not know, is just a form of reciprocity. So it's one of the better ways to establish borderless practice and promote licensure portability across qualified practitioners. So lots of other professions have this. Nursing has it, has compacts in play, physicians, physical therapists, and other health professionals, professional groups have compacts in place, but this is new for dentistry. So we've been trying to get this through. And as you can see, it does require that the licensee, that being in a partner state or in a participating state, has to have certain qualifications. And when they do, then they can get a privilege to practice, a compact privilege to practice in another participating state. And that it's just a smoother way to be able to get that borderless practice across professions. It helps with mobility, can help with access to care, particularly along the borders of states. So as you can see in this map here, the ones in purple, we've got about 12 states now that have fully enacted the compact. And then you can see the states in green are considering it with more kind of coming on each time. So the more states that participate, obviously, the better the situation. So let's go ahead and go to the next one. Next slide. So I wanted to talk about this bill also. It is an extremely controversial bill. It was SB 1124 is what the name of it was. And basically what this is allowing for a new function for dental assistants after they've completed some specialized training or testing. And currently they already have requirements that they have to do before they can legally take x-rays or polish teeth or place fillings. So this is a new function for them, and that would basically be, in really simple, plain language, clean teeth for patients who have healthy gums and no history of gum disease. So this is after, of course, a dentist or a dental hygienist has examined the patient and made that determination that the patient does meet the criteria and allowances for a dental assistant to take over and provide that very simple cleaning for a healthy patient, a non-periodontally involved patient. Proponents of this effort stated claims that it will alleviate some pressures on dentists due to shortages in the workforce, increased demand and increased wage expectations, and they believe this will also increase access to care. There's no real evidence to support those assumptions, so it will remain to be seen how helpful this actually is. And you can see some of the prerequisites and the training that's required. Go ahead, next slide. So as you can see there in the slide before, the requirements, and then here you can see some of the limitations that are in place. And I think it's worth noting that the Arizona Dental Hygienists Association, together with dental assistant advocates, work to improve this bill and are responsible for most of the requirements. And we put those in place, hoping to improve patient safety, provide for suitable oversight, and ensure the appropriate educational standards, which weren't there in the original bill as it was introduced. And I might say that it was the Arizona Dental Association that was actually backing this bill. And to honor the stakeholder process, because we went through that, the Dental Hygienists Association took a neutral stand, but I want to make it clear that that neutrality should not be construed as support for the bill. So we did not support it or promote it, but we did remain neutral. And go ahead to the next slide. And I wanted to just make sure everybody knew that just because the bill has gone all the way through the legislative process and has been signed by the governor, it does not take effect yet. It will not take effect until 90 days after the legislature adjourns. So some people mistakenly believe that once it's signed by the governor, it goes into effect. It does not. The date of signing by the governor also doesn't indicate the start date or the start time for those 90 days. The legislature actually has to adjourn. And the legislature is still in session, and it might be another few weeks before they do adjourn. So that would put the effective date somewhere in, not sooner than late August, and probably more likely in early September. Just because it goes into effect then doesn't mean it's actually ready to go, because the Board of Dental Examiners actually has to do some work to implement the plan, which they are working on now, actually, or beginning to anyway. The Hygienists Association, we went before the board in April and made some suggestions and some comments about the implementation. They have scheduled a special meeting on June 30th, as you can see here, to solely look at this item and work on the implementation plan with allowing stakeholders to have some input at that time. And one of the big things is that the language in the bill states that these individuals have to complete a board-approved training course. And so while there are a few things in the bill, in the law already, that kind of define that, there's probably more that goes into that, as well as just the mechanics of it. How is this actually going to happen? How is it going to be administered? And I do want to mention that we know that the board will be looking for the least burdensome approach to implementing this law, but we really don't want to minimize the need for robust regulatory oversight and for dentists and practice owners to comply with the law. And unfortunately, speaking broadly for the dental hygiene community, what the association certainly has heard is that dental hygienists are quite skeptical that this law will be adhered to as intended. And we recognize that if that's the case, that it would certainly be detrimental to the oral health of the public. And so we want to try to work with the dental board to really emphasize the patient safety and appropriateness of the implementation of this law. And in final with this, I did want to mention that unfortunately, there have been some folks who are promoting training courses already out there on the wide world web. And there doesn't seem to be any legitimacy behind them. So we are fearful. So we want people to be aware that right now, just kind of do blanket, the only institutions that are going to be able to provide this training are your dental schools and your dental hygiene schools. So if you see a website promoting training for this entity that isn't affiliated with one of our 2 dental schools or one of our 7 dental hygiene school programs or dental and accredited dental assisting programs, that they are not a legitimate provider of this education. And so that's just kind of a heads up. And I think that's it for that. Go to the last slide. And I will quickly just be remiss if I didn't do a plug for our upcoming educational conference, our 2025 Impact Conference here in Scottsdale, Arizona on August 15th through the 17th. It's great CE, a little bit of everything for all dental professionals. And so we welcome everyone. There is reduced registration pricing up until the end of July. So we hope that you can take a look at that. You can find the registration information at the hygiene website, azodha.org. There's registration information, and I think it's probably available and out there in the social media domain as well. And that's all that I have to say. See if there were any questions that we might have time for. Does the dental assistant need to be employed as an assistant prior to taking the training? Not necessarily, not necessarily. There are some of the prerequisites that are involved would imply that they have work experience, or at the very least that they have completed a pretty high level formal dental assisting education program. Will the board check off on offices with these dental assistants? Unfortunately, probably not. So our dental board is reactive rather than proactive. Therefore, the best you will probably get from them is information. And then how it would become known is only that there might be a complaint of some sort coming forth to the attention of bringing that forth to the attention of the board to check on. And they have to be certified DAs. There's two pathways: either have a current certification as a dental assistant, which is through the Dental Assisting National Board. They either have to have that or have graduated from an accredited dental assisting program.
Well, well, I don't know how I feel about it, but because I know that being in public health, I know that we require our dental assistants to have coronal polishing and X-ray certification certificates, but in private practice, they're polishing teeth and they don't have this certification. So that is the disheartening part about it. And I think as dental hygienists, I think we just need to educate our patients what a dental hygienist is and not just a dental assistant or, so forth. But thank you, Deb. That was great topics.
Thank you.
Always good to know about that stuff there. Thank you very much.